Hello my dear students, I am Dr. Vaishaly Bharambe. I have been teaching anatomy for last 25 years and I love it. What are we going to learn today? We are going to talk about the deep cervical fascia today. So deep cervical fascia is quite a big topic. So we are going to divide it into deep cervical fascia lecture 1. Where I am going to talk about what is deep cervical fascia, what is investing layer of deep cervical fascia and so on. And in my second lecture on the same topic, I'm going to talk about pre-tracheal fascia, prevertebral fascia, and of course your favorite, carotid sheath. So, before we begin, one little request to all of you, please. Please sit with your drawing books and your color pencils, or sit with any electronic drawing instrument that you prefer. But whenever I'm asking you to draw, I expect you to draw. It's not because I'm asking you, it's because this is a technique of teaching and learning which has helped students to have a much better understanding and recall. This is proved by research. Alright, so students, let's begin the class. I hope you enjoy it. So deep cervical fascia, the first lecture. Here comes my second request, students. I want all of you to look at this image on the screen. And let's begin to palpate some parts of our neck. Okay, believe me, it's needed for the lecture. Let's all begin. Are you ready, students? All right then. Please palpate your symphysis menti. Run your finger along the inferior border of mandible. Have you reached the angle of mandible, students? Good. Now go behind your mandible. Can you feel a depression here? That's where is your parotid gland. Okay, palpate it, go up. This beautiful cheekbone, okay, this is your zygomatic arch, okay. Now go behind your ear. Can you feel a projection coming down, right? So that is your mastoid process. Now go behind to the superior nuchal line and then go to the most prominent part of your skull, external occipital protuberance. Please use the image on the screen whenever in doubt. Okay, now run your fingers in the midline on the back of your neck. You will start to feel every cervical spine. Go down here to the most prominent spine called as the vertebra prominence. Okay, now here below you can feel your scapula. Run your fingers forwards along your clavicle. Can you feel your clavicle? Right. And then come back to the suprasternal notch here. Now let's go back up to the symphysis menti. As you go up, somewhere here, please palpate, students. Somewhere here is your thyroid gland. Go a little up. Can you feel something hard here? Yes. Now that is your laryngeal cartilage series. All of them, cricoid, thyroid and so on. Come back up to the symphysis menti. You must be wondering, when are we going to start deep cervical fascia? This was the beginning of deep cervical fascia. Know your neck to know your deep cervical fascia, right? So let's now begin by finding where is the deep cervical fascia. Now as students of anatomy, usually when we are trying to understand some anatomy, what is the first thing we are dealing with? We are dealing with the cadaver, my dear students. Cadaver covered by skin, right? So look at the skin, reflect the skin, okay? So now what are you looking at? When the skin is gone, what are you looking at? You're looking at the superficial fascia. Okay. So what does the superficial fascia contain? Let's take a look. You can see that it contains some amount of subcutaneous fat, some muscle called platysma. Alright. Are you okay with a muscle in your superficial fascia? Normally not. But yes, in the region of your neck and in the region of your face, you have got muscles in your superficial fascia. So in this case, I'm okay with it, there is platysma. What you also see is a lot of subcutaneous nerves for those beautiful sensations in your neck. And then you've got subcutaneous blood vessels, arteries, veins and lymphatics. See them, reflect them. The moment you reflect them, you come to your topic for the day, the deep cervical fascia. So what you are seeing here now in this image is skin, superficial fascia and finally the green colored circle, which is the deep cervical fascia. Okay. So let's begin a little bit of theory now. The deep cervical fascia consists of 3 layers: an investing layer, inside that a pre-tracheal layer, and innermost a prevertebral layer. You will feel, ma'am, you are enumerating these things. How are we supposed to remember all this? Yes, so let's use an image to understand. Here on the screen now, you are seeing the detailed image of a transverse section of the neck. Okay, let's remove the skin and superficial fascia. We're done with it. Okay, and now you're into your deep cervical fascia. Okay, now understand this outer layer, which is enclosing your entire neck, is called as the investing layer. It is investing your neck. Okay, so the investing layer of deep cervical fascia. Deep to that is your pre-tracheal fascia, which is passing, as you can see, in front of the trachea. Okay, and deep to that, enclosing the cervical vertebra and the muscles all around it, is your prevertebral fascia. If you look carefully, you will be able to see that the pre-tracheal fascia as well as the prevertebral are basically extensions from the investing layer of deep cervical fascia, right? So it is the investing layer only which has given rise to a layer that went in front of trachea and a layer that went in front of the cervical vertebra. So pre-tracheal and the prevertebral layers. Okay, right. So bottom line, summarize. Investing layer of deep cervical fascia gave rise to 2 processes. One that went in front of trachea is called as pre-tracheal. One that went around the cervical vertebra is called as prevertebral. Are you okay with this much? 2 processes? Very good. Okay. Now, deep cervical fascia is a fascia. It can't just float around, right? So I need to attach it. Where am I going to attach it? Okay. So let's begin the attachment. It's attached superiorly, posteriorly, inferiorly, and anteriorly, right? So again, you're going to palpate to understand. See, we have something called as a physical memory. Every action you take is going to get registered in your brain. Do it, all right? So let's begin. Again, use the image in case of doubt. The deep cervical fascia, the investing layer, is superiorly attached to the symphysis menti. Then along the inferior angle of mandible to the angle of mandible. Pause. You understand where we are going? We are now going upwards to all those structures that I was telling you. Got it? So again, symphysis menti, the inferior border of mandible, the zygomatic arch, the mastoid process, superior nuchal line, external occipital protuberance. So all these are the superior attachments of the deep cervical fascia. I think by now, if you have understood, you will know the posterior attachments. It is posteriorly attached to ligamentum nuchae and all the tips of cervical vertebrae. Got it? Now inferiorly, it gets attached to the only 2 bones you have here. Which 2 bones? You've got your scapula, you've got your clavicle. Fantastic. So it gets attached superior, posterior, inferior. What is your next attachment? There is nothing, ma'am, in front. What are we going to attach to? So you're going to, the 2 layers are going to come and get attached to each other in the midline, also attached to some of the laryngeal cartilages. Okay. So this is how we have completed the attachment of investing layer of deep cervical fascia. Okay. So now let's take a look at this image. See the collar that the sweater is having, the polo neck sweater. This is exactly how your deep cervical fascia encloses the neck. Okay, so if that helps, let's take a little bit of time and think. This deep cervical fascia, which is so beautiful, has completely enclosed your neck. It is giving that beautiful shape to your neck. Of course, mine is an aging neck, but what about yours? You're students. What gives you that beautiful young neck? It's the deep cervical fascia. Let's give it a silent thanks and move on. Okay. So now we're going to trace a horizontal tracing of the deep cervical fascia in your neck, followed by a vertical tracing of the same. So let's begin a horizontal tracing. Here comes the use of the drawing pencils and whatever drawing implements I had asked you to keep. Let's begin a diagram, dear students. So now let's begin our diagram. Students, Please begin your diagram by drawing your cervical vertebra. Okay, so here is your cervical vertebra. Here is the beautiful transverse process. Take it back, and here is your beautiful bifid spine. In the center, you have got the central canal, and in the corner here are the two foramina transverse area. Okay, now let's add to this diagram by drawing the ligamentum nuchae behind. Okay, before we go forwards, I'm now going to add a couple of muscles. Okay, so here in the side is your trapezius muscle, and here in the front is your sternocleidomastoid muscle. Okay, now let's take a look at what the deep cervical fascia does. The deep cervical fascia now gets attached posteriorly to the ligamentum nuchae. Okay, travels laterally. As it does so, it meets which muscle? It meets the trapezius. So it splits to enclose the trapezius. Okay. After that, it again begins its onward journey forwards, and it's again interrupted. This time interrupted by the sternocleidomastoid muscle. Okay. So it encloses the sternocleidomastoid and goes on to meet its partner of the opposite side. Now see how the deep cervical fascia has beautifully enclosed your neck. Now let's add a little bit more to this. Okay, so all of you dear students, please add in the neck the trachea. You're well aware that trachea is a U-shaped cartilage in the anterior region of the neck. Behind that, I request all of you to please add your esophagus. Okay, now what does the deep cervical fascia do? The part of the fascia that is enclosing the sternocleidomastoid gives rise to a layer that travels medially. It forms the anterior layer of the carotid sheath and then passes in front of the trachea, splitting into two layers to enclose your favorite gland. Now think of it, which is your favorite gland that gives you a metabolism? Okay, yes, the gland that gives you metabolism is your thyroid gland. So see how it encloses your thyroid gland. Similarly, now let's go back to the same layer that was enclosing sternocleidomastoid. It gives rise to another process that travels medially. Forms the posterior layer of the carotid sheath, meets its fellow of the opposite side. It also gives rise to a layer that travels posteriorly and encloses the cervical vertebra and all the structures around it. This is called as the prevertebral layer. So let's quickly summarize. A layer that went in front of trachea called the pre-tracheal layer. A layer that went around the cervical vertebra called the prevertebral layer. So two processes, fine. The deep cervical fascia enclosed two muscles, right? Posteriorly which one? Trapezius. Anteriorly which one? Sternocleidomastoid. Now look at your diagram and see the space between your trapezius and the sternocleidomastoid. Can you see a clear facial line there? This space below the line is called as the posterior triangle. Posteriorly bound by trapezius, anteriorly bound by the sternocleidomastoid. Okay, so now this investing layer thus forms the roof of posterior triangle. Similarly, look at the anterior border of sternocleidomastoid to the midline. This is the anterior triangle. So the investing layer also forms the roof of the anterior triangle. We're going to go off the diagram now and let's summarize what we have understood on this image on the screen. Okay, ready students? Keep your drawing things away and let's come back to summarization. Okay, so now here in the screen, you are able to see how the investing layer of deep cervical fascia splits to enclose two muscles. What are they? Posteriorly trapezius, anteriorly sternocleidomastoid. It forms the roof of two triangles. What are they? Forms the roof of anterior triangle, forms the roof of posterior triangle. Quick summary, two processes, pre-tracheal, prevertebral. Let's quickly come to the summary of it now. Take a look at the image on the screen and let's now understand How? It gives rise to two processes, pre-tracheal, prevertebral. It splits to enclose two muscles, trapezius and sternocleidomastoid. It forms the roof of two triangles, anterior triangle and posterior triangle. I think if you have understood up till now, we can take it forward to the vertical tracing. So they're going to do exactly the same thing, students. We are going to take the fascia up, we're going to take the fascia down and understand its modifications. Are you okay up till here? Come on then, let's take it forward from there. Let's draw again. You will think this is a drawing class, but believe me, at the end of the class, you're going to be thankful that we did all those drawings. So let's again pick up your drawing pencils and let's begin. Okay? So here, now I want all of you to start a new sheet. Okay? Draw your mandible. Okay? A section of the mandible as I am showing you. Just for perspective, I want you to draw the molar tooth as well. Okay. Here is your hyoid bone. Understand that extending from your hyoid bone to your mandible is the muscle called the mylohyoid muscle. Okay. Below that, now you can see your submandibular gland. Please draw it. Students, my advice to all of you would be enjoy yourself. It's fine. You're studying, yet you're drawing. If you're enjoying it, there's nothing wrong in it, right? Please draw your beautiful submandibular gland, and now let's come to understand what the deep fascia does. The investing layer of deep cervical fascia vertically approaches the gland from below and then splits to enclose the gland as you are seeing here in the image. Thus, the submandibular gland is enclosed by two layers of investing layer of deep cervical fascia. Okay, so one, it encloses the submandibular gland. Let's now see what it does in case of the parotid gland, isn't it? You remember I showed you the parotid gland here? Let's take it there. Now this time I want you to draw your zygomatic arch. Okay, here on the inside this is your external arch, and behind it here you're seeing the styloid process. Now let's again draw your favorite gland. Which one? Yes. We're drawing the parotid gland. Again, enjoy yourself, students. Please don't draw just because I'm telling you to. Please have a good time. Okay? The moment studies becomes enjoyable, it's going to be retained much more in your brain. Okay? Now let's understand what the deep cervical fascia does. Okay? From inferiorly, it approaches the parotid gland and then splits so that one layer goes to the styloid process and the other layer goes up to get attached to the zygomatic arch. So you feel, so what? There is something very important happening here. One, it is splitting to enclose the parotid gland. So it has enclosed how many salivary glands? Submandibular gland and the parotid gland. It has enclosed two glands. But as it is approaching your zygomatic arch, it is becoming especially thickened to form what is called as the parotidomasseteric fascia. If you can just kindly repeat it. Parotidomasseteric fascia. Now this fascia has clinical importance. You remember as a child you probably suffered from mumps. Okay, so mumps was an inflammation of your parotid gland. The gland is trying to expand. The parotidomasseteric fascia is preventing it from expanding, and this is the reason why there is a lot of pain in the parotitis or mumps. So that's one clinical importance. It is thickened to form the parotidomasseteric fascia. What about the layer that was going to the styloid process? It thickens to form a stylomandibular ligament that separates the parotid gland from the submandibular gland. So let's summarize as usual. Let's quickly summarize. Come back to the screen, keep your drawing implements away, and let's go for a quick revision. Right? So let's take a look at this diagram on the screen. You can see how the investing layer of deep cervical fascia splits to enclose the submandibular gland. 1. Let's go to the next image. You can see how the investing layer of deep cervical fascia splits to enclose the parotid gland, thickening to form the parotidomasseteric fascia and the stylomandibular ligament. So two glands are enclosed, submandibular, parotid. Two thickenings are formed, parotidomasseteric fascia and stylomandibular ligament. Excellent. If you got this, let's take it forward from there. Applied importance of parotidomasseteric fascia, what is it? Like I told you, if the parotid gland is inflamed and it tries to expand, the parotidomasseteric fascia right here prevents the expansion, causing that patient to have a lot of pain. Alright? Let's now take the vertical tracing downwards. We've gone up, we've enclosed glands, we've thickened to form fascia. Let's take it down now. This time, look at the image and see what happens. It encloses two spaces. Which spaces? Let's take a look. Alright. Here on the screen, you are seeing that this is the investing layer of deep cervical fascia, which is attaching itself to the clavicle in the form of two layers. Okay, one layer in the front, one layer behind, enclosing a space which is called as the supraclavicular space. Please hone in into that. Take a good look at the space. It's just a space above your clavicle. It is pierced by two structures. Can you see that? One structure which is coming from inside out, the supraclavicular nerve, which is going to distribute itself along your clavicle. And one which is coming from the outside in, that's your external jugular vein, which pierces the deep fascia here to finally drain into the subclavian vein. So what is the space formed above your clavicle? Supraclavicular space. Right. As you can see in the posterior part of it, the posterior layer of this fascia has formed a little compartment through which a muscle is passing called the omohyoid muscle. Please note this, we're going to need it later. Okay, let's now go to the next space called as the suprasternal space of Burns. Can you please use your finger? Go to your suprasternal space above your sternum. This is called as the suprasternal space of Burns. What happens? The fascia descends down, splits into two and gets attached to the sternum in the front and behind. And what does this space contain? JILS. The jugular venous arch, this is the space, the jugular venous arch, the sternal head of sternocleidomastoid, interclavicular ligament and some lymphatics. Can you revise this with me quickly? JILS, the jugular venous arch, interclavicular ligament, a few lymphatics and the sternal head of your beautiful sternocleidomastoid. What is this space called? It's called a space of Burns. Okay, so pause. Think. Two spaces. One above the clavicle, supraclavicular space. One above the sternum, suprasternal space of Burns. Okay, sometimes you remember the names also. Right. The last thing we want to consider in this topic today is that it is forming two fascial slings. One sling I already told you. For which muscle in the supraclavicular space? For the omohyoid. Okay, so it forms a sling for omohyoid. And please now look at this point here shown on the screen. It's a fascial sling for the digastric muscle. So your digastric is coming from your mastoid process to your hyoid and then going up. And as it is doing so, it is held down by a fascial sling of investing layer of deep cervical fascia. Thus, and this lower one is a fascial sling for the omohyoid. Summarize. Two loops or fascial slings formed for two muscles, digastric muscle and omohyoid muscle. Right. So we are done. We've completed in the last 20 minutes. We are done with the beautiful topic of deep cervical fascia. Take a pause. Think, what have we done? Let me also take a sip of my coffee. You can also have a little bit sip of water maybe. And let's now quickly go to the last part of today's class, which is revision. Alright then, students. Come back to the screen. Here on the screen, you can see two fascial processes. In front pre-tracheal, behind prevertebral. Fine. Two muscles are enclosed by investing layer of deep cervical fascia. Posteriorly trapezius, anteriorly sternocleidomastoid. Fine. It forms the roof of two triangles. Which two triangles, students? Posteriorly, posterior triangle, anteriorly, anterior triangle. It splits to enclose two glands. Below the mandible, submandibular gland. In this place, parotid gland. It is twice thickened. Parotidomasseteric fascia. On the deeper side, which ligament? Stylomandibular ligament. Two spaces, one above the clavicle, one above the sternum. The investing layer splits to form two spaces, supraclavicular space, suprasternal space of Burns. Okay. Finally, it forms two loops or slings. One is for your digastric and other is for your omohyoid. This 2 multiplied by 7 is a very beautiful and yet easy summarization of the distribution of investing layer of deep cervical fascia. Okay. Now, we come back to the same diagram that we had drawn earlier. Use this diagram to revise, my dear students. Let's see if it helps. Come back to the screen. It forms two processes, pre-tracheal, prevertebral. It encloses two muscles, trapezius and sternocleidomastoid. It forms roof of two triangles, posterior triangle and anterior triangle. Convinced? Okay, let's go to the next diagram. It splits to enclose submandibular gland and parotid gland. It thickens to form parotidomasseteric fascia, stylomandibular ligament. See how the diagrams are helping you to quickly revise in your brain. And finally, it forms two spaces and it forms two loops or slings for digastric and omohyoid muscle. So with this, we have completed the topic of investing layer of deep cervical fascia. I've put up a few questions for all of you. You can try and solve them. If you have any issues, obviously you're most welcome to give me a call. I'll happily sit and clarify them, or you can put it in the comment section and I or my team members will come forward to explain it to you. Okay. These are some MCQs as well, which I think you will be able to solve quite easily. My dear students, a little advice from me is going to come with every lecture of mine. A little progress each day is going to bring a lot of big results. Never lose heart. Just make sure you moved a little forward every day. Okay? So with this, I finish this class. I hope you enjoyed it as much as I do. I look forward to meeting you across the screen in my next lecture. Thank you so much.